I am joined now by a special guest, Dr. Chris Whitman. He's from Mobile Infirmary. Going to be talking about some things you might not consider when it comes to antibiotics, specifically with this week being Antibiotic Awareness Week. So I want to thank you first for stopping by.
Thank you for having me.
Now, we were talking just shortly about how this Awareness Week began, and it didn't start in the U.S., you said.
Yeah, this the World Antibiotic Awareness Week, it's a global campaign that started overseas and picking up here in the U.S., specifically here in South Alabama. Yeah. What we're seeing, the big focus this year of World Antibiotic Awareness Week is antimicrobial resistance. And what we're seeing here in Mobile and Baldwin County specifically are antibiotics that used to work even 5 years ago for simple infections such as urinary tract infections like our levofloxacin or Levaquin or our Cipro or ciprofloxacin. They used to have about 90–95% susceptibility to our common bacteria or pathogens. Now what we're seeing is that has dropped to about 60% or 50% depending on the location here in South Alabama.
Now, I want to kind of backtrack and talk a little bit more about that resistance, and just making a simple comparison here. Initially they were saying don't use hand sanitizer and soap because that will build up resistance to germs. And I guess it's kind of the same way with your body. If you keep introducing certain antibiotics, there can be a sort of resistance that's built?
Yeah, so when we think about antimicrobial resistance, it's even outside of the human body, but it's specific to each bacteria. So every time that we give an antibiotic, even if it's one simple dose, we're giving that antibiotic more information, or the bacteria more information. Bacteria are really smart, and every time that we give an antibiotic, they can build resistance. And right now what we're seeing is an overuse of antibiotics leading to this resistance. And
you also said that there are certain viruses that are going to take a certain amount of time to clear up, whether you have that antibiotic or not. So what can we do to kind of prevent this resistance that's building up now?
Yeah, well, one of the biggest things we can do so that we can preserve these antibiotics and so they'll be useful for us when we do have a true infection is to use them wisely. When we have viral infections such as COVID, flu, the common cold, RSV, antibiotics are medications made specifically to fight bacteria, not viruses. So when we're utilizing those, having that conversation with your provider and discussing, is the antibiotic really the right choice for me? Is there another option there?
Yeah, all right, good information and reminders there too. I mean, really, you are the best check. You got to ask yourself, do I need this or can I get through? Thank you, doctor, for stopping by.
Thank you very much.